Hi, I'm Abby, nurse practitioner here at Integrated Medical of Rockford. Wanted to talk to you a little bit today about our Gut Heal and Seal program. When we think about gut, a lot of people think of everything that has to do with the stomach. But the reality is the gut is everything from our esophagus all the way down to our stomach, our intestines, all the way to our rectum. So all of this is considered the gut. So when we talk about gut healing and sealing, we're talking about making all of that healthy. So we're not just talking about diarrhea, constipation, bloating, some of those tummy GI problems. We're also talking about things such as rosacea, skin rashes, brain fog, back pain, blood pressure, and look at these: thyroid, colon, but you also have joints involved in there as well, adrenals, think fatigue. So when we talk about gut heal and seal, we're talking about a way that we can actually go in and make so many other parts of the body function a lot better. I'll give you an example. A patient might come in, they might say, I have a rash. And we think, what is going on? What is causing the rash? We can't figure out what this rash is. Well, a rash in a lot of ways can be due to an immune system response. 80 to 90% of our immune system is found in the gut. So when we can go in and heal that, we can heal our immune system. The goal is to regulate the immune system, which affects every other system in our body, our hormones, our brain, all those things we mentioned before. So when you come in and we talk about the Gut Heal and Seal program, there's several parts into it. I don't know how many of you have heard of leaky gut before, but it's something that's really going around, and it's really intestinal when the intestines aren't just working well and things can pass through. So I'll show you something. Here is a picture of our intestines, and I hope you can see this really well. So these little parts of here are called tight junctions. This is the wall of the intestines. This is into the bloodstream. So if you can see here, there's a normal tight junction. Everything's nice and tight, and they're coming close together. This is a normal intestinal integrity because it's only going to allow certain things in and out of this area. If you look over here, you've got spaces in between here, and then you have all these little particles passing through, and look where they're going. They're passing into the bloodstream. So you have pathogens, food, allergies, all kinds of things. So this is a picture of leaky gut. And that's one of the things that we want to take care of when we do the Gut Heal and Seal program. So how do we go about doing this? Well, let's first answer the question, why in the world would we have leaky gut? Life causes leaky gut. When we live in a world that's toxin, with medications, with stress, these things impair the gut integrity. Also, when our bacteria isn't quite right. So when we look at downplaying, or not even downplaying, but modulating the immune system, we go for correcting leaky gut. There are 4 phases in correcting gut. First, we want to get rid of the things that might have caused it to begin with. So if stress is involved, you want to address the stress. If there's toxins, at some point you want to decrease your toxic exposure. If there's medications, there's some meds that you have to stay on, and that's okay. And there's some meds that you maybe be thinking of coming off. At this point, though, since the gut already is impaired and we have particles passing through, whenever those particles come through, they actually interact with the immune system, and the blood cells see them as abnormal. They see them as a parasite, a virus. It doesn't know. So you have this immune response. So with leaky gut, you have a chronic immune response going on. We need to dampen that down. One of the things that is first affected and that first triggers this would be the foods we eat. And it's usually foods we eat all the time, not necessarily unhealthy foods, apples, oranges, peaches. Whatever we eat all the time goes through, it filters through. Remember, nothing is supposed to get through here, but the food particles filter through, go into the bloodstream, and then the blood and the body then has a reaction to it. So we first need to figure out which foods is causing this immune response, part 1. We then eliminate them. So how do we find out what we have? We do a food sensitivity test. An IgG test lets you know what foods your body is currently reacting to. We eliminate them, and then we want to put you on a good digestive enzyme, because when the food particles go through, they're not properly digested. And with a lot of us, we don't have a good amount of hydrochloric acid in our stomach, so food's not digesting well. So we put you on a good digestive enzyme so that small particles can pass through until we heal the gut. We also put you on a really good probiotic because whenever you have a leaky gut, you have an imbalance in your flora. So you need to correct that. And then we put you on something to actually heal that and seal it so that all of a sudden, you're not looking at a gut that looks like this, but you're looking at a gut that looks like this. That's what we want. So that's the heal and seal part. This process takes about a year. So with the gut heal and seal program, you come in, you do that food sensitivity test you for all those foods. We eliminate those foods. For the first 3 months, you actually have your own health coach through the immunolabs that we use, and she's going to walk you through how you're going to go through and eliminate those foods. So if you really like wheat, what's a great substitute for wheat? If you really like dairy, what's a great substitute for dairy? So she's going to help you make those changes. Along with that, you'll be seeing me 6 times in a year. So this is a 12-month program. Because if you think of it, it took a long time for your body to become in this chronic condition to where you have a leaky gut. So you have to give it some time to actually heal itself. So 12 months of the program, you meet with me for 6 months. Kaylee will be 3 months. You meet with me for 6 months. During this time, we are documenting how you're doing. We're getting a look at your symptoms. Maybe we need to change something. Maybe we don't need to change something, but we work very closely together. By 8 months, we start reintroducing those foods because by that time, the gut should have started to really heal and seal itself. The idea is not to keep you off these foods forever, but to be able to get that gut healthy so that we can give you these foods again. So at 8 months, we go ahead, we reintroduce the food, and the plan is by 12 months, most of those foods should be able to be reintroduced. Sometimes they can, sometimes they can't. But the bigger process is that we want to see whatever condition you came in for is actually better. And I don't know if I mentioned this, but actually mood. There's a gut-brain connection to where the bugs and the health of your gut actually affects your moods. Serotonin, 80% of it is made in your gut, 20% is made in the brain. So that's an overview of the Gut Heal and Seal program. Again, it's not just for people with gut issues as far as abdominal pain, bloating, constipation. It's for people with a wide variety of things because the gut holds so much at the core of what makes us healthy. So if you have any questions about it, contact the office. I'll be more than happy to bring you in if you want to talk about it some more. But that is the Gut Heal and Seal program in a nutshell. Let us know if you have any questions.